I'm Dr. Marsha Sanity.
And I'm Dr. Caleb Moore.
And this is
the Free Smiles Podcast.
Today we are talking about dental hygiene.
Mm-hmm.
And you and I have been dental hygienists for a long time. You more than me, because you're older.
Why do you have to say it like that?
Because you're older, and everyone needs to know. Because I'm youthful.
I know my wrinkles are
Anyways,
showing.
you look younger than me, but
yes, suck it.
So
am I allowed to say that?
Yeah,
okay.
You can say whatever you want within reason.
Perfect.
But being a dental hygienist, there's a lot of rewarding moments and a lot of challenging moments, and it's the same way in dentistry. But
yeah.
I want us to really focus on the dental hygiene profession today because you and I just value it so much.
Oh my gosh, I value, I love, and I try to just support my hygiene team. I mean, to the nth degree. When it comes to just really anything, it's like supporting them on what they see with that patient because their eyes are on that patient for longer than you are on that in that certain recare appointment or whatever it may be, but just kind of valuing their opinion on how they view things, how their days goes, what they think is better for the office, how they can improve things. Because I guess in my experience, most hygienists want things to continue improving and to be challenged and to have that growth. So I think putting a lot of energy and focus on your hygiene team is only going to make you a better doctor, your patients have a better experience, and just an overall just better thing for our field.
It's going to, just empower the team. I think I actually have an example of this today. My hygienist, her patient came early and she finished up with her cleaning early. So I was in the middle of a new patient exam and I had kind of, I try to do nonverbal cues with my hygienist, like if they're ready or if I need them, but so I had looked at her and I kind of told her to come here because I wanted her to meet the new patient and I had a feeling that it might be either perio or at least a gingival scale. Mm-hmm. And I really want my team to own that and to be the providers for that because they are providers, you know? And so I had asked her to come in and she met the patient. She really owned it. She came in, she just flowed into the conversation. She came in and did the perio charting for me. And then she ended up doing same day gingival scale. But, that brought a little bit of chaos because there was a patient who was already on our schedule and a patient that was scheduled, it was a little bit of an accelerated ordeal, which we don't do often. But so my front desk was confused and they're like, Dr. Moore, why did you have her go into perio chart? And I think, just understanding that hygienists have autonomy over their day. It wasn't me saying you have to come meet this patient. It was her making the decision, this is going to be very valuable to me. And I have a team to support me to figure out, bringing back my next patient or starting the x-rays so I can meet this new patient. And we sat down together after and we're like, well, man, that was kind of crazy. But it was great how it worked out for her because she actually connected with the patient really well. And that's going to become her patient, ideally for life now.
Yeah.
So one of the things that you said, talking about having, variation in your day and just making sure that your hygienist feels good about what they're doing and bringing joy into their career would be giving them autonomy over their schedule and allowing them to be a useful resource within the team. Like that, having her come in to do the perio charting for me so I could go seat my crown and I had a patient who was there for a limited in pain, that was beyond beneficial for me.
Yeah, and I think, at least my experience when I was a hygienist, I went through, different practices, I temped a lot when I was getting going through school and moving and doing things like that. I think temping is just a great experience to view different offices and how they do things, especially if you're first starting out. Just going and temping and just seeing, kind of how the local doctors at your area, how they practice or what they're kind of into. And that can really just give you an idea of what kind of environment you want to work into. Yep. For me, it was about autonomy. One of the first doctors I worked with at a school, which, surprisingly, I was, first office I ever worked at, he came in and he's like, well, what do you think we should do on this patient? As far as treatment planning. Right. And setting priority over things. And because I had some assisting background, I was like, oh, well, obviously we should start here, here, and here. And he was like, okay, great, let's do that. And I'm like thinking, well, wait a minute. What are you doing?
You're the boss, right? Or like, yeah, like what?
I was like 21 or 22 at the time.
Yeah.
I'm like just deciding this person's fate. Obviously he took into his own account, but it kind of opened up the idea to me that I know more than I think I know.
Yeah.
Like when you're getting out of hygiene school, like you really do know a lot.
Yes.
But also be humbled that you have so much to learn.
Mm-hmm.
And finding the right doctor to work for that's willing to talk with you about patients, support you on your, autonomy when it comes to that stuff is so important. And it makes you feel valued in not only your career, but in your life. Like if you go home and you had a really rewarding day, even if it was challenging, like challenging can be a positive thing.
Exactly.
But if you feel fulfilled and you feel like your team supported you, like that translates into your, your relationships with your significant others, your relationships within your friends. Like you feel pride in what you do. And I think there's no price tag on that. There's no price tag on finding the right fit for you and also trying to challenge yourself and learn different things.
One of the trickiest things that I remember from being a dental hygienist was finding the fit. I had been in, multiple practices, small private practices, DSOs, and not only finding the fit, but even just growing as a provider and how I learn and take feedback, because there were some days where the doctor may have had the expectation that I would be co-diagnosing or that I would know, what the treatment plan should be, and really just setting him up to come in and just reinforce it instead of, talking about it for the first time. And I wasn't up to par, right? Or that we weren't in alignment. Not necessarily that I didn't know or understand, but we weren't on the same page.
Yep.
So it could be really hard, stepping into that and then feeling defeated at the end of the day because you don't feel like you did what you were supposed to do, or that you didn't provide patients with, the best experience or the best care. So I think, yeah, that was probably one of the most challenging challenging things for me was how do I find the right fit so that way I have a doctor who is going to want to sit down with me and explain, this is where my head is at, right? This is the risk assessment for the patient. This is what I would do here. Here are some tips on how you could, just talk about it with the patient beforehand. And so it took a lot of time to find that.
Yeah, and I think also just being, like, I think a lot of doctors don't think about it, or maybe hygienists don't think about it, is when I'm walking in for like my hygiene exam, I want my hygienist to give me everything they know. You know what I mean? Like I want that summary, I want that like 2-to-1 transfer, however you want to, call it in your practice, but I want that to be a conversation with us and not just be, even if I've met that person before, met them 10 times, or I've done fillings on them a million times, just those little kind of just nuanced conversations about, hey, we looked at this person's health history today. They are still taking this blood thinner, or they're having surgery and whatever. Like you really do have time to talk to a patient and say, wait, let's set up your next appointments or life or success, really, when it comes to things, because you're finding out those details, and being detail oriented is so important. I can't stress that enough. But it just knowing the why of like, why am I asking you these questions, and empowering your hygienist to be like, I'm in command of this room. I know all about this patient's health history.
Right.
I know about their perio history. I know what things we're watching. I know what things that have treatment plans on them, what things we have photos of, what things we have x-rays of. Just kind of like staging that. So I know when I come in the room, and there's certain hygienists that do this very well, and it's just second nature to them, and they go above and beyond, and they can do extra stuff. I mean, at some point in my career, that's kind of where I was. I was kind of I eventually end up being like the lead hygienist, and I would end up training other patients, or not patients, training new team members when they came on, especially when I was leaving for dental school, just training, my replacement once I was leaving.
Right.
That was a very, almost like, I don't know, like full circle kind of feeling of, as I came into that practice, which was a highly aesthetic practice, a very like high-end practice, and going into that thinking like, oh, I'm not good enough to be here. I don't know enough. I'm not good, all that stuff. And then leaving being like, oh, I'm the main person here that's going to tell you how to do what I didn't do or didn't know that I didn't know 2 years ago when I started that position. So I think just, taking that whole experience and taking every experience you has as a growing moment, that's just a good, life skill to have as well.
Yeah. It's funny that you mentioned that too, because, I think about when I was transitioning out of hygiene, I was like, not that I had like peaked, right? Or that I still couldn't learn or grow, but I felt like I am at the point in my career where I'm ready to make those decisions. But one of the things that I love that you said was being in control of the room, not really necessarily in control, but knowing so much about the patient that the patient feels comfortable, right? Because, if your hygienist is able to recognize and co-diagnose and relay all of this information, what does that say about the person who hired them or that they're working for or working with, So I can't stress that enough that you should work towards getting to that point in your career where that treatment planning, at the back of a hand, right? That you can just be like, look at this tooth. This is what I think, you're probably going to need. I'll have the doctor confirm, but this is what we're looking at. Because at the end of the day, majority of patients are going to come back for your hygienist.
Yep.
They love your hygienist. They want to see your hygienist every 6 months or whatever their recall may be. And they love you too, but they get that time with them. They know about their family, their kids. They know, hey, we've been watching that number 18 for a while now. I think it's time, you and Dr. Marsha have a chat about, that tooth, right? So,
Right.
I think there's a lot of joy when I think back to being a hygienist that it brings me of, having that fulfillment of, you're not the doctor, but you are damn good at your job and you have these relationships with people and you take care of them. Yeah.
Well, yeah, and I mean, it is like at the end of my hygiene career, I mean, I was certified doing laser. I was also EFTA trained. I could place fillings. In Colorado, you can actually diagnose and do exams. So I was doing that part of things. Obviously, in other states, there's different rules of it. But really, at the end of it, I felt like I was ready to do that next time. I was ready to, go into dental school because I was, checking all these boxes mentally, and I felt really confident in that. And I mean, I learned so much through my, dental school and like even so much more now after practicing and doing things like that. But really, that growth, I felt the same way. Like, not that I was always learning more. Like,
Right.
things always sparked my interest, but it almost helped my next steps of being like, hey, this is what I want to focus on next. Like, I really love general dentistry, and it really made me want to stay in general dentistry because I like having kind of that wide variety of things. I didn't want to specialize. I mean, I wanted to have like a niche in certain things that interested me, but I liked getting to know patients. I didn't want to just be the specialist that they were referred to for one thing and then being gone. I wanted to kind of build that like community aspect of it and just, you can have, life-changing experiences with, the doctor that you see for that one surgery, but I think it's a lot more rewarding having just those relationships with your patients that come in and just like remembering who they are and knowing now I'm seeing their husband or now I'm seeing their kids or, whatever that may be. And as a hygienist, I think you get that more so. You really do. Like, you get more time to talk with your patients. I mean, I did. I really enjoyed just, honestly, like my favorite thing was having like a 90-year-old, war veteran. And I would just talk about, whatever. Not talking about the war unless he wanted to, because I would totally get into that. But but I really did like enjoy just sitting down. And if I have like, a cancellation, obviously I want to, be productive in that time. But I would just sit and talk with that patient for an extra like 15 minutes because that's probably the one thing that they get to do to like get out of the house or do whatever, especially if there's someone who has like a caretaker and they don't get a lot of, social aspects of it. Like, that to me was just like, I wanted to be like a geriatric hygienist because I just wanted to hang out with old people and talk with them.
Exactly. Yeah. And so I think that's what makes dentists who have been hygienists makes them great dentists because we get that time with people. And, we've been able to do things in our career at a very early stage because of the experience in hygiene. And so I think about people who are considering going into dental hygiene school. There is so much value in it, even if it's not, your end goal. If you're considering going into dentistry and being a dentist, taking that extra step to become a dental hygienist was invaluable. You and I have been able to do things in our career at such an early age because we were dental hygienists and we got to spend time with people and communicate and have the experience and success and failures of treatment planning. So it was really rewarding. But on the other end of that, there are things about being a dental hygienist that may not be great, right?
Well, yeah, I mean, and there's pros and cons. I mean, I would say, kind of go over your initial thing that you were saying about, being a hygienist and how rewarding it can be and getting into that, and not, like, when I went into hygiene, I didn't want to be a hygienist my whole life. I didn't want to be in dentistry. Like, I had no desire. I wanted to travel the world and, be an anthropologist or something of that nature. Which I think I found that in other ways in my career. Like, that stuff still interests me, and human development and cultures still interest me, but I just learn about that stuff on my own time now. But I had no desire. I had no desire to be like, oh, I'm going to be a hygienist. I just thought, hey, I'm an assistant. I'm in high school. This is a good next step. I really had nothing I truly had passion for. I loved what I did, but it wasn't like, oh, I want to do this. I want to be a dentist after that.
Yeah.
So I think just going through that program, obviously it's rigorous. It's exhausting. That had its pros and cons and ups and downs through that. I mean, you're going through your early 20s at that point. So everything's chaos. Or at least it was for me. But I think coming out of that, I had so much growth in my life and the flexibility of it. So I think coming into the hygiene career, you can work 3 days and still make a good living. You can have kids, or you can have a family, or you could not do any of those things and do it for a few years and then go into something else. I think that's just the difference of, do I want to get an associate degree and do practice clinical hygiene and then, move on to something else, finish my degree later? Do I want to go through a bachelor's program? I'm glad I went through a bachelor's program. Just to me, I was already at Ohio State. That's what the program they offered. I didn't really think that much about it. I know having a bachelor's degree would help me maybe get a different kind of career field afterwards, just having that 4-year degree, but it wasn't it was more of an afterthought.
Yeah.
Yeah. I feel I'm more thought out now. But
well, yes, you are now, but maybe, nobody should be expected to be that thought out at 18, right? But because you practiced clinically after you got your bachelor's for a few years, right?
Yep.
And then
I went back in. Yeah, exactly. So I practiced for 4, 5, 6. I don't know. I was at least out for 2 to 3 years before I started doing night classes to go apply for dental school later, and that took me 4 years to finish because it was night classes, and I was taking one class at a time and paid for that on my own as I went along. So it took me a little bit longer to get my prereqs for dental school done. But and even through that process of going through night classes and thinking about doing dental school, I was still oh, do I really want to do this? You know what I mean?
Well, yeah, because my last year of hygiene school, my clinic director had to sit me down or the program director actually, and was because I told her, I was I don't know if being a dentist is for me. I love where I'm at. I love this career. I don't know if I want to go on and go back to school. And she was no, you're going back. You need to go back. Yeah. And at the time I didn't understand why. Now I do. But I, like you said, you were still enjoying what you're providing people and the career that you had at the time.
Yeah, I was very well fulfilled. I loved my life. There's, looking back on it, I didn't really understand the breadth of what being a dentist was. You know what I mean? Because you work next to dentists all day long and you understand kind of what they do. But to me, I just wanted to learn more and continue learning. And that's why I wanted to go to dental school. I'm okay, I've already maxed out my experience. I'm already at the top of the field. I can get paid however much I want to. I can go wherever I want to. Okay, what next? But maybe that's my personality, though. I'm oh, I'm doing this. Whenever I'm feeling settled, I'm oh, what next? Exactly. Or even before I'm feeling settled, I'm what next? Which my husband loves. I think now we're finally ready to be a little settled for the summer and not have another project.
That's great.
Yeah.
I want to focus on some issues in the dental hygiene community right now because I still have a big community from dental hygiene school that I'm in touch with.
Yeah.
And one thing that they wanted us to talk about today was So what do you do if you're a dental hygienist in a practice and you are up to date on the latest guidelines for perio, right? And you want to transition, you have all these patients who should be treated for perio, but the dentist isn't reinforcing you, or you're trying to have these conversations with patients, and the dentist comes in and says everything looks good, or is brushing off the perio aspect. I thought it was really interesting because this happens.
No, this happens all of the time.
Yeah.
My first advice to you is you should leave that office.
Exactly.
And I don't say that because like whatever, but I think we see and this is just experience over the years. There's so many, like I wouldn't say older because age has nothing to do with your experience and your continued education. There's a lot of great older doctors that are treating perio, diagnosing perio, helping people keep their teeth and not having this disease go undiagnosed. But there's a lot of older doctors that just don't want to do more. They also, or if they're young out of school, they don't really understand it. So I think there are so many practices that will support you in that. But if you love your practice, you like your doctor, I think having like a one-on-one conversation with maybe your office manager or maybe some of the other hygienists that you work for and be like, hey, this is what I'm seeing. Like I had this, not so much that the doctor wasn't supporting me because I had chose to work for doctors that did support this.
Yes.
And I had weeded out the ones that didn't because I would temp at offices that didn't diagnose perio and I knew I could not work there. You know what I mean? Like I would be like finding 7-8 millimeter pockets of bleeding and radiographic calculus, but then I don't know. It's a nightmare, and it's also just makes your career and your day feel so unrewarding and unsupported that it's a tough conversation to even come into a practice that maybe the hygienist wasn't diagnosing it properly and the doctor wasn't like seeing that or taking time to look at things like that. Like I've been in plenty of practices where I came in and I was the one starting to diagnose it and the doctor was like, oh yeah, like whatever you think, supportive. But I'm like, well, what was your hygienist doing for the 8 years before this?
Yep. And
what were you doing not being on that? So there's that whole aspect of it. But having those hard conversations with patients about, hey, this is the gum disease I'm seeing. This is the things that I'm looking at systemically that this can affect. Let's talk about your overall health. Let's talk about what your goals are. And just having that information, most of my patients who had never had perio diagnosis before were like, yeah, let's do that root plane. Let's do this thing. Even if it means numbing me up and doing all this stuff that doesn't sound comfortable. The doctors that I worked with were like shocked that some of these patients were like, yeah, I'm on board. Yeah. Because it's all about having that open dialogue, that conversation. And like having that doctor come in and supporting what you're doing. Like you can't have division in your team, and it's just not a good thing. And that's a shout out to all the doctors out there that aren't supporting their team or doing it properly. Like you need to be, because they're not going to stay around. And they shouldn't if you're not going to support them.
Yeah, and I love that you touch base on even the doctors who are supporting, but you're still having to make that transition because it's a reality where perio was undiagnosed for a long time, and I'm seeing that in my practice now. The other associate, my partner who I work with, she's also was a dental hygienist, and so we're empowering our hygienists, and we're having these conversations with patients about, we're not going to dig into why this wasn't diagnosed, 5 years ago, but this is where you are. This is the standard of care, and this is what we can do for you. So, like you said, finding doctors and team members who will support you in that, give you the time to properly perio chart and educate and do, all of the aspects of what is a dental hygienist, right? Having the time to be able to do that. So that way you feel fulfilled and you're giving the patient, what they need.
Yeah, I definitely think there is almost like a pinch point when you talk about like time and having your, hygienist be supported. I see this it's almost upsetting to see it in a lot of the like DSO corporate ways of seeing hygiene is like stacking your schedules. Like you get 45 minutes per patient and you have to jump between rooms every 30 minutes. And, it has its place, whatever it may be. There's, you choose to go there as a patient because your insurance is taken by them and you're in that network. But then your hygienist isn't like, what are you getting out of that besides having your teeth be polished at the end of the day? It's like, is it truly like therapeutic? Are you truly having, the care that you need. And as a hygienist, like, is that your starting point? Maybe. Yeah. Like, you're just getting out of school. Is there only so many jobs in your community? Or some of those going to be more so those like high turnover type of offices? And that's fine to be starting there. But I think that's on you to then push yourself to be better so you can work at an office that does support you, because you have to start somewhere.
You do.
And
any experience is good experience if you're taking that experience and growing from it and deciding, something that you'd mentioned earlier was, when you're temping, that when patients or, maybe not patients, but when people ask me, how are you at this stage in your career? And it's like, because this whole time that I've been throughout dentistry, I'm taking every experience and saying, this is not how I want to take care of people. This is not what I stand for. And being a dental hygienist, what we stand for is being prophylactic, right? Or preventing any type of disease or preventing periodontal disease or, caries, right? That is our job, is to prevent. And if we don't have the time allotted to do that, to actually scale, get all of the biofilm off, get the stain off, then you're not doing what we took an oath to do.
Yeah, exactly. And it's a balance, because there's times where you have a more chatty patient or you want to chat with that patient more. And I think that's one of those, kind of like meme jokes of like the doctor asks you a question, but then their hands are in your mouth. But there's a nuance to talking with a patient when you're in the chair, when you're trying to get things done, when you only have so much time. But there's also, you'll get there. I don't know. I feel like it's like, don't stress about having every single thing done perfectly. Like, even, my hygienist would come to me and be like, hey, I didn't have time to do this today. And like, they're all stressed out because they're like, oh, I didn't have time to do this today, or blah, blah, blah. And I'm like, okay, well, you're 99% of the time you find the time to do it. It's like, but they reflect on that. And I think that's important to have those like reflecting moments with your fellow hygienist, or like even like having another hygienist that you work with to be like, hey, do you mind looking at this radiograph? I think this is what's happening. Like, when I was new out of school, I did work with one other hygienist at my first practice. And I personally just loved being like, hey, like, what do you see about this? What do you see about this? Do you think about this? And I enjoyed that my hygienist trusted me later to be like, hey, what do you think about this patient? Or I'm seeing like, hey, there's some 4s or 5s, but then there's no bleeding. Like, what should this diagnosis be? And, just putting all those pieces together and just talking about things. Like, you learn so much. You learn so much from like how someone else looks at something, the different things that I didn't think about, and just putting all those pieces together. And eventually you'll just, it'll click. And there's still moments, even like in our day-to-day, where we're like, hey, do you think this is my cavity?
Right.
Because it's like, is it going through? Is it not? Is it going through? Is it not? Then you're like sitting there with the x-ray thing.
Yep.
One eye closed, one eye up,
Being a perfectionist. And I love that you said, I mean, we always want to, if you're trying to be perfect, at the end, at least you're striving for excellence, right? And so, as a hygienist, I was actually talking to my partner about this the other night we were just reflecting on just my career in general, but we were talking about the first office that I ever worked for, and the doctor was amazing. The type of care she was giving was amazing. But I remember I was, 19 turning 20 years old, coming out of hygiene school, and I had to be on it like every day. I had to go through, the interviewing with the patient, understand the why behind it. And then when she come in, I'd have to have the gloves and the mask on the certain side of the operatory. And then I would have to be standing a certain way. I couldn't be leaning on the counter. And then I would have to repeat it back in the order that, that she wanted. And it was all for good reason, right? But I remember the amount of stress that I had, being that young and trying to perform at that level. It was difficult because we're not perfect. And, I'm going to miss a medication in that handoff, or, miss, a pocket that I should have mentioned, right? But at the time, I felt like it was the end of the world. And I wish somebody, or even myself now, looking back, could be like, this is an experience and you're going to grow from it. And it actually allowed you to feel what it's like to be at that level, even though I wasn't ready for it at the time. And I can say that I was ready to be on that trajectory, but maybe not at that age. But looking back, it's like that set me up at an early stage of my career to now have the skills that a really great hygienist has and a really great dentist will
Well, and
have.
also like having expectations. Like you want to set high expectations for yourself. And I think, there's being too hard on yourself for things, or, I think that's just our nature. In a way, is just like so much self-reflection that we're just like constantly like, oh, this minute thing is not perfect, so I'm gonna think about it all night, and not sleep. But I think as a hygienist, we were that. It's not like it was only now as doctors were that way.
Yes.
As hygienists, we were also that way. We were, trying to be the best that we can, could be at that moment, trying to give whatever that day's 100% was.
Exactly.
Because it is, it's you and that person in that situation, and there's only one person that you can kind of blame your failure on or your non-success, and that's ourselves. And that's I think that's a great thing. I'd rather have myself be the fallback of a failure than anyone else, just because I know I can take that as feedback and then grow from it.
Yeah.
I think it's it's a tough field. It's not easy. You have difficult patients. I was just talking about before we came in today that at the end of my day, I had a crown to prep on an upper molar, and patient is elderly with like a C-spine issue. So she was literally at like an acute 45-degree angle for this whole prep. And you get that in hygiene as well.
Yeah.
You're trying to do root planing or scale someone or trying to do a good job, but all the odds are against you. Because it's people. It's working on humans, and you just had to kind of laugh about it, because as my neck is sore and driving me crazy, I'm laughing about it.
You have to. And you have to know that there are providers and teams out there who will support you as a hygienist, support you in your perio-diagnosing, whether, you'll have those fits where they're either over-diagnosing or under-diagnosing, and just know that you're going to find, where you're meant to be, and know that you have true value in your profession, and what you can bring to that team. It's invaluable. Yeah.
Oh, it is so invaluable. And I think I'm always trying to support my hygienist, being like, hey, even if you have an issue with like doing a root planing case, you can't get something, come and get me.
Exactly.
I can help, like whatever that may be. And I think, if you're looking for a job, let me know.
If you're looking for a job, let us know. Also, if you would like support or guidance or anything on, becoming a dental hygienist or what the process was like for us, please feel free to comment your contact information and we'll reach out.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.